everyone, my name is Dr. Dileep Kumar. I am as a lecturer at the Department of Physical Therapy, Indus University. First of all, as you all already know that we have started the anatomy tutorial series. Our first recording was on the bony landmarks, features and muscular and other structure attached to the clavicle. Now we are moving toward the second recording which will focus on the scapula bone. So let's have a look what are the clinical features of the scapula bone, what are the bony landmarks of the scapula bone, where it is basically located and how it serves, how it provides the attachment to the muscles, how it provides attachment to the different structures. So let me show you firstly, okay. Before we start, मैं आपको ये बताता चलूँ कि scapula bone जो है वो कहाँ पे placed होती है, where it is basically located. It is located in the costo-lateral aspect of the thoracic wall. अगर मैं आपको show करूँ, this is your thoracic cage, okay, rib cage, and here the long bone, if you can see this long bone, the triangular in shape and the flat, this is the scapula. If I show you the posterior aspect of the skeletal, this one is your right one and this one is your left one. यहाँ पे जो red marking और blue marking है, you know these are the muscle origin and insertions. सबसे पहले हम जो है वो bony लैंडमार्क्स के ऊपर फोकस करते हैं कि बोनी लैंडमार्क्स स्कैपुला की क्या है. तो स्कैपुला एक फ्लैट बोन है, इफ यू कैन सी, ओके, दिस वन इज योर राइट स्कैपुला, ट्रायंगुलर इन शेप है, फ्लैट बोन है जो कि प्लेस्ड है कोस्टोलेटरल एस्पेक्ट ऑफ द थोरेसिक वॉल. इफ यू सी इट इज प्लेस्ड लेटरली और नॉर्मली दे आर नॉट इन लाइन विथ ईच अदर. जो नॉर्मल प्लेसमेंट है, दिस इज द मीडियल बॉर्डर ऑफ द स्कैपुला. ये दोनों अलाइन नहीं होते, नॉर्मली दे आर प्लेस्ड इन लिटिल बिट आउटवर्ड पोजीशन जस्ट लाइक दिस, बट दिस इज नॉट दिस इज अ स्केलेटल जस्ट विदाउट द मसल्स एक्सेट्रा. आई एम टॉकिंग अबाउट द लिविंग ह्यूमन बॉडी. तो जब आप नॉर्मली जो स्केपुला प्लेस्ड होती है वो लिटिल बिट आउटवर्ड पोजीशन में प्लेस्ड होती है. बहरहाल, तो अगर हम स्केपुला को अगर आप किसी को भी, जब आप किसी का भी असेसमेंट करते हो, जब आप उसको पीछे से देखोगे तो स्केपुला के दो सरफेसेस हैं. वो पहला सरफेस जो आप पीछे से उसके स्कैपुला को देखोगे, दैट वुड बी द पोस्टीरियर और डोर्सल सरफेस. मतलब ये व्यू जो आप देख रहे हो स्कैपुला को, दिस इज द डोर्सल सरफेस. सो दिस वुड बी द स्कैपुलर डोर्सल सरफेस. ये स्कैपुला का डोर्सल सरफेस हो गया. एंड दिस वुड बी द कोस्टल सरफेस जो उस तरफ फॉरवर्ड फ्रंट व्यू से फेस करेगा. सो इफ आई डेमोन्स्ट्रेट ओवर दिस स्केलेटल, दिस इज द dorsal surface and that would be the costal surface which you will see from the front view. When you talk about the borders, it has the medial border. This one is the medial border. This is called the medial border, and this is also called the vertebral border because they are facing or they are in relationship with the vertebrae. These are the vertebrae. So scapula is placed into the costolateral aspect from the second rib to the seventh rib. If you make a countdown, this is your first rib, this is your second rib. So starting from the second rib to the seventh rib, मतलब second rib से लेके जो आपकी seventh rib है यहाँ तक स्कैपुला जो है वो पूरी placed है, located है. Then this is the lateral border and this is also called the axillary border, right from the glenoid, इनको भी हम पढ़ेंगे, glenoid cavity to inferior angle. This is the inferior angle. So this whole border is your lateral border, and this is also called axillary border because it's in relationship with your axilla. So if I show you in this one is your left scapula, that would be the lateral aspect, and this is the medial border. I show you on right. Okay, this one is your right scapula. This is the medial border, and this one is your lateral border. Lateral border faces the axilla. That's why lateral border is called the axillary border, while the medial border faces the vertebrae. That's why this is called the vertebral border. And then finally you have a medial, lateral, and then you have a superior border. If I show you this way, the superior border, this is your superior border. Just like if I show you in this view, this is your superior border. This whole way is your superior border. So we have a lateral border or axillary border, we have a medial border or vertebral border, and then we have a superior border. तो तीन borders के बाद स्कैपुला में तीन प्रोसेसेस होते हैं, तीन प्रोसेसेस में जो सबसे डोमिनेंट स्ट्रक्चर है, ऑल यू कैन सी दिस इज द स्पाइन ऑफ स्कैपुला. ऑल यू कैन सी दिस लॉन्ग स्ट्रक्चर, लॉन्ग वे स्टार्टिंग फ्रॉम द मीडियल बॉर्डर and moving toward the lateral border and ending with a process जिसको acromion कहते हैं, वो भी हम पढ़ेंगे. Okay, this whole structure is the spina scapula and it lies at the level of T3 जो third thoracic vertebra होता है उसके लेवल पे. तो अगर आप किसी की spina scapula को palpate करते हो तो आप किस thoracic के किस लेवल पे होते हो? third thoracic vertebra पे. If I show you this long structure, this structure is basically the spina scapula. And it when you come at the level of spina scapula and you come toward the vertebra, it would be the third thoracic vertebra. Okay, so we have a three processes. हमारे पास तीन process हैं scapula में. We have a spina scapula. This is called the spina scapula. It has apex. The first part where it is attached, या हम कह लें कि जो starting point है spina scapula की, इसे हम apex कहते हैं. Then it goes round way toward lateral. Then it has superior surface, it has inferior surface. If I show you, it has superior surface like this one, it has inferior surface downward, it has lip, the upper lip, the lower lip, then it goes or then it radiates, propagates toward laterally, and then finally it ends with a process. This is called acromion process. So we have a three processes. The one is the spina scapula, and then we have a acromion process, and then we have a coracoid process. Coracoid process is some like a bent finger. If I show you on this, we have a three process. This is the spina scapula. Okay, this is the acromion process. This part which articulate with the medial lateral end of the clavicle to form the acromioclavicular joint. This is the acromion process. And finally, this structure, if you can see, this is the coracoid process. This one like a bent finger, this is the coracoid process here. This is the coracoid process. So we have a three processes, we have a three borders and two surfaces, and we have a three angles. तो यहाँ पे तीन का जो रेशियो है वो थोड़ा सा आपने फॉर रिमाइंडर, जब मैं आपको रिमाइंडर या याद रखने के तौर पे, अब तीन एंगल्स हैं हमारे पास. तीन एंगल्स किस तरह करके? ऑल यू कैन सी द इंफीरियर एंगल एट द लेवल ऑफ T7. दिस इज योर इंफीरियर एंगल. This is the inferior angle, all way coming toward the laterally. जैसे हम laterally जाएंगे तो ये जो आपके glenoid cavity है, इसके नीचे जो एंगल, ये जो इसको overall angle, this is the glenoid angle or lateral angle. So we have a inferior angle, we have a glenoid angle, and we have a superior angle. If I demonstrate you on this, this is your inferior angle, and this is the glenoid angle or lateral angle, and then you have a superior angle. So we have a three borders, we have a two surfaces, we have a three what we can say the angle, we have a three processes. So this is somehow you have to memorize the bony landmarks. Now what the other structures, what we can see on the costal surface, what we see on the dorsal surface, let's have a look to it. So if you focus on costal surface, whole way you see a depression. आपको यहाँ पे ये पूरी जो depression feel होगी या fossa. This depression or fossa is called subscapular fossa. नाम ही indicate करता है, ये attachment देता है subscapular muscle को. That's why this fossa depression is called subscapular fossa. So this whole depression, a long depression, जो कि सिर्फ एक ही होता है costal surface पे. This whole structure or depression is called the subscapular fossa, जो कि attachment देता है subscapular muscle को. If you focus on the costal on this subscapular fossa, the number 1, 2, 3 and 4, these lines, these oblique lines coming medial to lateral, these oblique lines are ridges basically. These oblique ridges, they basically provide a wide area for the more or stronger attachment for the subscapular muscle. Okay, now you focus, this is the medial and this one this is the lateral border, and here you can see the coracoid process. The coracoid process, at the junction of coracoid process there is a notch. If you can see, this notch, this pain is indicating a notch. This is called the subscapular notch, suprascapular notch भी बोलते हैं. This notch is basically for the entry or for the entrance of the suprascapular nerves. Suprascapular nerves, those vessels which basically supply the supraspinatus and infraspinatus muscles, we are going to discuss it. So for the entrance or for the entry of this notch which is located at the junction of coracoid process, and which is a part of the what we can say located in the superior border of the scapula. Okay, now the dorsal surface, this long structure जिसको हमने स्पाइन ऑफ स्कैपुला जो है हम कहते हैं, स्पाइन ऑफ स्कैपुला बेसिकली डोर्सल सरफेस को डिवाइड कर रही है दो हिस्सों में. इफ यू फोकस द होल डोर्सल सरफेस इज बेसिकली डिवाइडेड इनटू टू पार्ट्स by the spine of scapula. The upper one, which is a smaller fossa, smaller depression, and the lower one, which is a larger one. If I show you on this hole is the dorsal surface. This hole is the dorsal surface, and this spine of scapula is basically dividing the dorsal surface into two fossa. What we have, the lower one, which is the larger one, and the upper one, which is the smaller one. अब जो ऊपर है तो उसको कहते हैं, अब ये स्पाइन के ऊपर है तो इसको कहेंगे सुप्रास्पाइनस फोसा. फोसा मेडिकल में डिप्रेशन को कहते हैं, सुप्रास्पाइनस बिकॉज ये स्पाइन के ऊपर है. जो स्पाइन के नीचे होगा उसको हम इंफ्रास्पाइनस कहेंगे. तो पहले हम जो सुप्रास्पाइनस फोसा है स्पाइन के ऊपर है तो उसको कहा जाता है सुप्रास्पाइनस फोसा. तो हम इस तरह कहेंगे कि जो छोटा फोसा है, द स्मॉलर वन विच इज अबव द स्पाइन ऑफ स्कैपुला इज कॉल्ड सुप्रास्पाइनस फोसा. Now the medial 2/3 of the supraspinous fossa and the superior surface of the spine of scapula are giving attachment to a muscle which is called supraspinatus muscle. अब इस supraspinous fossa में जो muscle है, नाम ही indicate करता है, अब इस fossa में जो muscle होगा उसको हम supraspinatus कहेंगे because it lies in the supraspinous fossa. So I repeat, the spine of scapula which is dividing the dorsal surface into two fossas basically. अगर आप dorsal view से आप देखोगे, एक वो फोसा, एक स्मॉलर छोटा सा फोसा है जो कि स्पाइन के ऊपर है जिसको हम सुप्रास्पाइनस का नाम देंगे. तो सुप्रास्पाइनस एंड द सुपीरियर सरफेस ऑफ द स्पाइन बेसिकली गिविंग अटैचमेंट टू सुप्रास्पाइनेटस मसल, व्हाइल द फोसा व्हिच इज बिलो द स्पाइन ऑफ स्कैपुला दिस इज कॉल्ड द इंफ्रास्पाइनस फोसा. और ये अटैचमेंट किसको देगा? इंफ्रास्पाइनेटस को. तो इंफ्रास्पाइनेटस, द होल इंफ्रास्पाइनेटस फोसा along with the inferior surface of the spine, they are giving attachment to a muscle which is called infraspinatus. Supraspinatus is initiator of abduction. जो हमारी abduction initiate होती है, supraspinatus is basically the abductor of shoulder joint, and infraspinatus what we use the mnemonics, the SITs. जो SIT का formula है SIT, supraspinatus, infraspinatus, teres minor and subscapularis. जो SIT, these are the lateral rotator of the shoulder, और while the subscapularis is the medial rotator. तो subscapularis coastal surface पे है, dorsal surface में ऊपर आ गया supraspinatus, नीचे आ गया infraspinatus. Now the only muscle teres minor जो कि हम SITs वाला formula अगर हम use करते हैं. Okay, so another structure, if you see, there is a communication between the supraspinous and infraspinous fossa. If you focus on this notch, there is a link between the supraspinatus. If I show you in this notch, this is the supraspinatus and this is the infraspinatus. There is the communication between the supraspinatus and infraspinatus. Now this notch is basically between the spine and the glenoid. This is your glenoid cavity. This is the glenoid cavity in which the head of humerus articulate to form the glenohumeral joint. Okay, this notch is called spinoglenoid notch because this notch is between the spine of scapula and the glenoid. तभी इस notch का जो नाम है spinoglenoid notch है because ये spine of scapula और glenoid के बीच में बनती है. Now what is the function of this notch? This firstly this is the communication between these two fossas. Suprascapular notch से आके they will come inside the supraspinatus fossa, and they will enter into the infraspinatus fossa via this notch. So this notch is basically providing a passage or a tunnel to the suprascapular vessels, and long way the suprascapular vessels will enter into the infraspinatus and they will supply accordingly. तो इनका मेन जो मकसद है जो वो एक टनल रास्ता प्रोवाइड करना कि जो सप्रास्केपुलर वेसल्स हैं जो कि सप्लाई कर रही हैं मसल्स को, जिसने इंफ्रास्पिनेटस मसल को सप्लाई करना है, तो बेसिकली वो उनको टनल पैसेज प्रोवाइड करते हैं. तो दिस इज द रोल ऑफ द स्पाइनोग्लिनोइड नोच. Then you focus on the, when I come on the glenoid cavity, this is the glenoid cavity, and the main role of the glenoid cavity is to articulate with the head of humerus, which articulate to head of the humerus to form the glenohumeral joint, which is a pure shoulder joint. Okay. If you notice on the glenoid cavity, if you focus on the glenoid cavity, you have a tubercle below the glenoid cavity and you also have the tubercle above the glenoid cavity. अगर ये जो होल glenoid cavity है, glenoid cavity जो है उसके नीचे एक छोटा सा ट्यूबरकल है, छोटा सा. अब ये glenoid cavity के नीचे है तो इसको हम कहेंगे इंफ्रा glenoid tubercle. इंफ्रा मतलब बिलो, glenoid glenoid के नीचे. Infra glenoid tubercle, the tubercle which is present inside or below the not inside but below the glenoid cavity. And supraglenoid tubercle, if you focus on this, the supraglenoid tubercle, the tubercle which is present above, superior to the glenoid cavity. Let's focus on this. This is the infraglenoid tubercle and you have a supraglenoid tubercle. The names are itself indicating they are giving they are below and above the glenoid cavity. Okay, there is the infraglenoid tubercle. Then if you come just below at the level of infraglenoid tubercle, there is the attachment of another muscle. So we are talking about the lateral border. Now we are moving toward the lateral border. Here is the attachment of a muscle which is called teres minor. So if you focus on the lateral border just below the infraglenoid tubercle, there is the attachment of a muscle which is called the teres minor, and just below it this is the teres major. So if you focus on lateral border is a thin strip टाइप स्ट्रक्चर. ये एक थिन स्ट्रिप टाइप जो है स्ट्रक्चर है, लेकिन ये जैसे ही नीचे आती है इट्स गेटिंग थिकर, ये थिक एंड रफ होती जा रही है. इफ यू फोकस ऑन द लेटरल बॉर्डर लॉन्ग वे कमिंग फ्रॉम द अप, दिस इज here you can see this is coming upward from a thin strip type structure, and as it comes down it's getting thicker and rough. तो ये रफ और थिक होती जाती है जैसे ही बॉटम पे आती है. इनका भी जो है वो रफ होने का एक रोल है, वो मैं आपको बताता हूँ. ओके, सो वी आर टॉकिंग अबाउट द मस्कुलर अटैचमेंट. सो जस्ट बिलो द infraglenoid tubercle we have a teres minor muscle, and then just below it we have a teres major. So if I place my fingers like I place my 3 fingers, so the number 1 finger is giving attachment to the teres minor, and the 3 muscles 3 fingers are indicating to the teres major. So teres minor जो है वो ऊपर होता है and teres major उसके नीचे होता है. Okay, we were talking about the glenoid tubercles. The infraglenoid tubercles gives attachment to the long head of tricep muscle. Tricep जो कि एल्बो का एक्सटेंसर है, तो ट्राइसेप वी हैव ट्राई मतलब 3, तो ट्राइसेप के 3 हेड होते हैं. एक हेड तो इंफ्राग्लेनोइड ट्यूबरकल पे उसकी ओरिजिन होती है, और जो सुप्राग्लेनोइड ट्यूबरकल वो ओरिजिन देता है लॉन्ग हेड ऑफ बाइसेप. बाइसेप मतलब 2, तो बाइसेप के 2 हेड होते हैं. एक हेड बाइसेप का जो है वो सुप्राग्लेनोइड ट्यूबरकल से निकलता है और एक जो है वो कोराकोइड से. बहरहाल तो जो बाइसेप के 2 हेड होते हैं, लॉन्ग हेड एंड शॉर्ट हेड. लॉन्ग हेड बाइसेप का सुप्राग्लेनोइड ट्यूबरकल से निकलता है. if I place my 2 fingers like this, so my upper finger which is moving is the supraglenoid tubercle, and the muscle gets origin is the long head of bicep which is the elbow flexor. When you talk about the infraglenoid tubercle, this part here the muscle is getting origin is the long head of tricep which is the elbow extensor. Okay, and then just below it you have a teres minor, then right after it you have a teres major. So this is how the lateral border is giving origin to the muscles, while the medial border is giving insertions to the muscle. We are talking about the medial border. This was all about the lateral border and the inferior angle, superior angle. Now we are talking about the medial border. Okay, if you talk about the medial border, just like this whole way is your medial border, coming from the superior. If I show you, coming from the superior angle, apex of spine, and downward toward the inferior angle. This whole structure is basically a medial border, which is also called the vertebral border. Now if I show you the muscle attachment, the superior this medial border, the upper part of the superiorly this area from the superior angle to the apex of spine. This is the apex of spine. This small structure, if I show you, this is the triangular in shape. This is called the apex of spine, where from the spine gets start basically. तो superior angle से लेके जो एपेक्स ऑफ स्पाइन है, ये वाला जो पार्ट है, ये मसल, ये वाला पार्ट एक मसल को इंसर्शन देता है, विच इज कॉल्ड लेवेटर स्कैपुली। लेवेटर स्कैपुली, लेवेट मतलब किसी चीज को उठाना, तो स्कैपुला को रेस करने वाला, लेवेट करने वाला जो मसल होता है, जिसको हम लेवेटर स्कैपुली कहते हैं, लॉन्ग वे कमिंग फ्रॉम द सर्वाइकल, इज गेटिंग इंसर्शन ओवर देयर। यहां पे उसकी जो है वो इंसर्शन होती है। ओके, जैसे ही हम एपेक्स ऑफ स्पाइन पे आगे, एपेक्स ऑफ स्पाइन से थोड़ा ही नीचे, दिस वे, इफ आई प्लेस माय वन फिंगर, this area which is triangular in shape is giving insertion to another muscle which is called rhomboid minor। ठीक है, यहां पे rhomboid minor, और उसी के बिल्कुल नीचे the whole way is giving insertion to another muscle, rhomboid major। तो if I talk about the medial border, the on top you have a levator scapulae, just below it you have a rhomboid minor, and right after it you have a rhomboid major। So on medially you have a rhomboid minor and rhomboid major, on laterally you have a teres minor and teres major। एक और चीज, जो मीडियल बॉर्डर है वहां पे ज्यादातर मसल्स इंसर्टेड हैं, जितने भी मसल्स हैं वो दे आर इंसर्टेड। व्हेन आई मूव दिस कोस्टल border of the coastal aspect of the lateral border of the scapula is very thick। if you see, you can palpate it, is very thick, this is thin, and the coastal aspect of the lateral border of scapula is very thick basically, and it basically works as a lever, for the action of serratus anterior, because when the serratus anterior contract or the scapula moves in multiple direction, we know there is a relationship to every shoulder movement, there is a relationship of the scapula, जिसको हम scapulohumeral rhythm कहते हैं। बहरहाल, तो ये जो coastal aspect है lateral border का, it basically works as a lever, it basically works as a lever for the action of serratus anterior। तो जब भी serratus anterior work करेगा, it will work accordingly